Well, welcome everybody to the Foot Health Network Roundtable, the first one of the fall, and it's on enhancing your practice through key strategies. I want to welcome everybody again, and we're basically having a session focused on engaging everyone and talking about the key concepts of the key strategies and four pillars of private practice to strengthen your practice, enhance your practice, and enrich your life. And we're going to do a brief overview of the four key points. And they're going to, for the next four roundtables, we're going to deeper dive into those four key points, each individual one, because there's a lot of things to cover and a lot of pearls. So we're going to do a brief overview today. The first half hour is going to be presentation. And then the second half hour, we're going to have for questioning and answer period. And so if you have any questions, you can put them in the chat while we're speaking so that we can have a good run of all the questions and none get forgotten. So if you think of any question while we're talking that you want, just stick it in the chat on the side and we'll go through them in the question and answer period. So first, I'd like to introduce for 6 partners in the Foot Health Network, and we've had this service going on for the last 2 years, 2.5 now, and we're all been in private practice and in the profession of chiropody and podiatry for many years, and we just wanted to get together a network to be able to help our fellow colleagues and teach and help and enhance everybody's practices and share knowledge and provide services to help people strengthen their clinics. So I'm going to go ahead and let each of our partners introduce themselves and tell us just a brief little bit so everybody knows. I'll start with you, Dave.
Yeah, I'm Dave Smart. I'm from Northern Ontario in Sault Ste. Marie. If you don't know where to find it on a map, you just look at the globe and it's where every Great Lake meets. That's where I live. I've been practicing for almost 30 years, graduated in 96. And it's just a passion of mine to share all of that knowledge. Because when we started, we had no road maps for us because it was brand new. We seemed feels like you almost frontiered the private practice industry as far as podiatry goes in Ontario. And it's time to pass the torch and share our knowledge. And I'm excited and passionate about that.
And Jody. So if you haven't realized, we're 3 couples. So go ahead, Jody.
My name is Jody Smart. I am also a practice management coach at the Foot Health Network, and I work alongside my husband as his practice manager. And yeah, tonight I'll be talking, and Dave will be talking on the pillar 4, which is keep the staff, which we're passionate about.
Peter?
Hi, I'm Peter Ferguson. I'm now semi-retired. I was fortunate to be able to sell my practice or our practice in 2021 and moved to Nova Scotia, which is where we'd always wanted to move to. I'm currently practice a day a week or so in Halifax. As a podiatrist and spends most of the time selling or doing Foot Health Network stuff.
I'm Kathy. Ditto what Peter said. Only I don't work in Halifax 1 day a week. I work in our local village, Chepstow, 1 day a week. And so we've been through enhancing our practice, and we were very much working on enriching our lives right now. We sail, we cycle, we hike, wake up in the morning and decide what we're going to do.
Go ahead, Tina.
Oh, I was going to let you go. Okay. I'm Tina Rainville, and I'm practicing in Timmins, Ontario for 27 years with Pat. And I'm going to be presenting the first pillar of success, and that's the building the schedule. My passion is numbers and scheduling and efficiencies and statistics. That's my role in the Foot Health Network. And so that's what I'm going to be presenting this evening.
And I'm Patrick Rainville. And I don't know if you guys know, but we're in Timmins, and beautiful Timmins. So we've been practicing here for 27 years. And we're well on the way at the end of our career and transitioning to more coaching than practicing. And I'm pretty well there, and Tina's going to get there very shortly. So we want to share all these beautiful things that we've helped people with and how we got to where we are today. So we'll start off by sharing the screen here. Okay, so tonight what we're going to do is we're going to introduce 4 key pillars that we've found out that we were able to help numerous practices with. And every single time we've helped practices, we start to see patterns. In our own lives, we saw patterns too, right? Thanks again for joining us. And I think Dave called it earlier. This is a networking thing. So all of us here, we networked before we actually got together as a business, but now we want to network with everybody else in our profession across Canada. So we're helping people all over the place. And what we want today is we want you guys to basically understand and engage and connect with not just us, but also your fellow colleagues. So here are the pillars. I'm going to introduce them. Then each one of us has a section that we're going to just give a brief overview of what the pillars actually are. And like we said earlier, the next round tables in the months ahead are going to break these down, and that will take us into the new year. So the first pillar is build the schedule. If we don't have a schedule, we're in trouble. If we don't have patients, or get the patients. If we don't have patients or know how to get them, again, you're going to be in trouble. And if you don't mind your money, you can make it all you want, but if you don't mind it, again, you're going to get in trouble. And the biggest trouble we all get into in private practice is staff. We have a hard time getting them. And we're going to talk about that too.
So pillar one, the schedule is one of the most foundational building blocks of the practice. I'm going to put out there the question of what scheduling challenges do you face? And you can put that in the chat if you want so that we can talk about it afterwards. But from what I gather, the biggest scheduling challenges that I gather from talking to clients and talking to fellow colleagues is, one, people not showing up, or two, having no room to see new patients and being swamped with foot care, maybe not having time to get in those urgent appointments or getting new patients in that really need our help. So those are some of the major scheduling challenges that I tend to hear the most often. There's 3 key strategies to building the schedule. And again, this is the foundation of a solid practice. It starts with the schedule. The first thing is balancing the schedule. So templating the schedule to fit the scope of practice. I'll often see in clients, especially if you've been in it for years, or when we first start, it's like, we'll take anybody that needs an appointment. Of course, you want to get as many people in as you want to see as many people as you possibly can. But over the years, it creates a snowball effect of foot care snowball that builds and builds and builds. And suddenly there's no room to see new patients. There's no room to fit surgeries in or urgent appointments. One key foundation for balancing that schedule is templating that schedule to allow for a full scope of practice, not necessarily being fully booked with foot care all the time and not able to see clients that need to get in right away for urgent cases. So templating the schedule is important. The other thing to keep in mind is the percentage of new patients being seen. And done some research on this, and a healthy percentage of new patients is about 12, 13, 14% of all patients seen in the week ideally would be new. This is what keeps the practice rolling and continuously growing. Have a certain amount of attrition rate. You really want to make sure that the practice is continuously growing with new patients. You'll lose patients from their moving, they're passing on, they just don't need the service anymore, they're better, their condition has been resolved. So we need a continuous flow of new patients. So that's balancing your schedule. The next strategy we go with in building the schedule is minimizing downtime. So controlling the percentage of arrivals and the percentage of schedule filled. Percentage of arrivals, a lot of times the stressor is patients no-showing, and how do you handle that, and what do you do, or how do you punish the people that no-show? And we found from experience and dealing with clients and dealing just in our own clinic over the years that punishing no-shows and trying to charge them doesn't really fix the situations. It has a lot to do with the prevention of the no-shows, controlling that percentage of arrivals, and ideally trying to have a percentage of arrivals up at about 95% or higher, because that's the gravy in the clinic. The next thing is the percentage of schedule filled. So monitoring how much of the schedule is actually filled in the weeks ahead. And obviously, the fuller the schedule, the closer to 100% filled, the more efficiency you have. And again, the more profit in the gravy, because a lot of the profit in the business comes from those last few percent of patients that arrive and the last few percent of the schedule that's filled. The last kind of touching base on building the schedule is improving the efficiency. So This kind of goes along with templating the schedule and having a good range of different types of appointments and enough new patients. It's what is your average billings per appointment? And so this is really important because it takes into account the cost of non-billed visits. It takes into account of what types of appointments are the majority types of visits. So is it the majority of foot care? Is there quite a few orthotics in there? Is quite a few high billed services or footwear? So the actual average billings per appointment is a key tracker to know the health of the clinic and the actual prediction of what the revenue is going to be for each week. So those are basically the main points, strategies for building the schedule. I'm going to touch on this deeper when we have our roundtable on that, but those are pretty much the main points.